Hello, welcome to Tongue Talks with Damon. And my very special guest all the way from Melbourne, Australia, is Dr. Forgan-Smith.
You can call me George. You can call me Jiggly.
Jiggly.
Not anymore.
George.
Bless her heart. Bless her heart.
Bless her heart.
Jiggly was a icon and she only just died last week.
Oh my gosh. Now you're telling me.
Jiggly Caliente.
Oh, actually, yes, I did.
Yeah.
So we will own her and do a tribute. Shout out to Jiggly.
Cheers, Jiggly.
Cheers to Jiggly. I'm letting a little water out. I'm so glad you're here because I know you're in New York City and you travel internationally and you teach all over the world about the issues and the pleasures and the safety that matters to so many queer men. It's like everything we want to know from our doctors but are afraid to ask. We come to you because you're one of those people who is such a source of pleasure-based, sex-affirmative, reasonable sex help and education.
Oh my God, you make me sound like I do good stuff.
You do amazing stuff, George. You do amazing stuff. But before I ask you about all the amazing stuff, I do want to ask you, what do you like most about your body?
I've been augmenting my body for years, so I like my collection of ink.
Yes.
So
You say augmenting, you mean with ink?
With ink.
Yeah.
I used to have piercings, but I took them out.
So I don't know how, you don't have to show it. Just your arms are covered with ink. Now your back and your butt.
We should get a back shot.
Is covered with ink.
How does this work?
This is for YouTube.
Yeah, this is for YouTube. There you go. There we
go.
go. That was beautiful. Thank you for showing that.
No, but it's really cool, and I'm very, very fortunate that over the addition of different editions of my life have had additions of tattoos. Like my master at the time, now my partner, now I don't know, he's not still a partner, but in a different form. So the big character on my butt is his name in Chinese. So
Which is what?
Zhang.
Zhang, okay.
Which means sword in Chinese.
So I was going to say, how do you decide? How do you curate and create and decide what you want to put on your body?
It's interesting, the first tattoo was this, there's a tiny little fish hidden away in there.
Oh,
right.
Okay.
And that was my...
I don't know people, but right there, yeah.
It's so freaking small.
Yeah.
And it was a defining, I'm going to get a tattoo. And then it just kind of kept on growing. But if I like an artist, and I'll go, well, I really want their work. So the stuff on my back is an artist who was originally from Brisbane, but moved to Copenhagen. And so he did that ink for me. But I'm kind of painted into a Japanese style corner now. So it's like, okay, just going to finish off in Japanese style. But
Japanese style. Okay.
yeah.
How old are you?
Me, I'm 52.
52. Wow.
52.
Wow. So I'm 54. We're very
there you
close.
go.
When did you start augmenting your body?
Oh, the first tattoo was 18. Then
The fish.
The fish.
The fish was 18.
And
What was the occasion for the first one?
I was originally from Brisbane and I was in Melbourne with a mate and I really liked his tattoo. I was originally, and if I had my time again, I would have had a wolf's head on probably my shoulder.
What?
A wolf.
A wolf's head, okay.
Because that was the first tattoo I liked, but I was like, oh my God, it's too big. And I'm like, Jesus Christ, nowadays, I've sat in parlors where people are getting ink and this big, bald man sort of, and I'm saying, dude, what are you getting? And he's like, I'm going to get this tiny little yin-yang thing. And I'm like, dude, get a bigger tattoo. He's like, oh no, I'm getting it for my girlfriend. And I said, dude, if you're getting it for your girlfriend, don't get it. Because you're not going to like it in 5 years. And no, it's for you. And I just kept on adding. And then this one, if I do a high kick, oh, there we go. So that's an X-ray of my leg. There we go. And there's a big snake on there. You can't quite see the snake, but you can sort of see the X-ray there, right?
Yeah.
So that's the Staph of Asclepius,
Wow.
which I got when I graduated from medicine.
Oh, okay.
Yeah.
Wow.
So that was a celebration of that.
Wow.
And then the pants sort of just organically came, and
So when you look at your body now, what do you feel?
what do I feel?
At 52, you look at your body.
Yeah.
What are the feelings that come to you when you see your naked body?
Well, see, that's a tricky one because I was getting ready for IML, and of course, it's a big leather event,
Yeah.
and I used to be quite thin, and getting the, I had all my leather when I was really thin, so I'm trying to get into leather now, and I'm like, oh no, this stuff doesn't fit. So, Melbourne people, at the next Northside Bazaar, there is going to be a whole bunch of 32-inch stuff being given away.
Okay.
And that money goes generally to one of the AIDS foundations. So I'm like, yep, I'm totally cool with that. But I think considering that I have a shitty back and a few other things going on, I'm in good nick for 52.
Good nick.
So, good nick.
Good nick. Good nick. Good shape.
Yeah.
Yeah.
Because
my dad
had his heart attack at 53.
Oh, wow.
So I've got 1 year to go.
Okay.
But I'm doing everything I can to not have that heart attack. So look after your heart. You only get one.
Heart health is important, cardiac health.
Mm.
And so when you were trying to fit into your leather, do you give yourself a hard time? It feels like in IML especially,
Yeah.
it feels, tell me if I'm off, it's such a body accepting environment. It seems like it's an environment where people of all different shapes and sizes are welcomed and appreciated and desired and embraced.
And that's what I kind of had to embrace as well. And I suppose the other thing is that I've had to sort of go through a period of, well, this is where I'm at.
Mm-hmm.
And you have to kind of be realistic and say, well, I'm not 30 anymore or whatever. And I imagine there are probably a few Ozympec scripts going around pre-IML.
Mm.
And it's interesting. With the new data about heart protection in Ozympec, I'm kind of okay with writing scripts for Ozympec, as long as people understand its limitations and things like that.
What are the limitations of Ozympec?
Well, it only works for solid food. Doesn't work if you get all your calories through liquids.
Oh.
It doesn't work. A lot of people will
The
do
beer and the wine won't make a difference.
soda and stuff.
Soda, yep.
I have put a paper into the Australian sexual health thing about PrEP on demand and Ozympec, because Ozympec delays the emptying of the stomach by an extra hour. So if you're taking PrEP on demand, there may not be enough concentrated drug where it needs to be, like in your rectum or your cervix, for it to be protective at 2 hours. So now my standard PrEP on demand question is, first, do you know how to do PrEP on demand? And then I always ask, do you take Ozympec or whatever?
Yeah.
And they're like, yeah, I do. And I said, well, here's what you need to know. And so I'm recommending like 4 hours before, or the morning of is even better. But that brought up so many other questions, like gastric emptying is really complex, and what's the most important part of PrEP on demand? Is it the first 2 tablets or is it the next 2 tablets? And a lot of questions.
Do we have the data to answer those questions? Do you feel?
Well, we know that, so cheers to Edwina Wright, the queen of PrEP in Australia. She's the most amazing. You should get her here if she's in New York.
Okay, Edwina, you heard it.
Edwina Wright.
Come to my tub. Come to Brooklyn.
Tub time.
Come do a tub tub.
We've looked at papers that talk about people living with HIV when they're taking their drugs every day, that it does not appear to affect the absorption. People who have had gastric bypass, it doesn't appear to lead to lower levels of the drug. But if people have had gastric surgery or are on a lap band or anything like that, I generally say to my patients, look, you're better off just taking it every day if you can. And so
PrEP or treatment?
Oh, sorry, PrEP. Well, PrEP, yeah.
Okay,
treatment,
we're talking about PrEP.
Treatment for people living with HIV and treatment, particularly when they're just about to get the surgery, because they can't swallow tablets for about a month or 2. I'm always saying, look, maybe you should consider the injectable HIV treatments, because that eliminates the whole stomach.
It's another helpful reason why we need the injectables and why it's so good. We have
Absolutely.
injectables for treatment and prevention now.
I'm really bummed that the cabotegravir PrEP was declined by the Australian government.
It was?
Yeah.
Okay, so let's talk about that. So I know we're throwing around a few terms. I think some people watching this know what we're talking about, but so Lenacapavir is in America is the FDA approved injectable. It is for people who are using in PrEP, and every 8 weeks would be able and willing to go to get an injectable.
Yeah.
And if they can do that, and when they do that, they just take an injectable and they don't have to keep taking
don't have
pills.
to worry about it. So
Okay, but you're saying in Australia that was not approved.
it's available, but it's not covered by the government. So a medicine that's covered by the government will cost a maximum of $30 to $40 a month, or a session of a drug. But if you want to buy it out of pocket, we're looking at about $2,000.
Oh!
And that wouldn't be covered by insurance like it would be here.
That's a huge difference.
Yes. But lenacapavir, 6 months, if that comes out, amazing. So that got a standing ovation at AIDS Munich.
Right. So lenacapavir, as we're sitting here, it is not FDA approved, but soon it will be in the US. Yes. Do I sit up? Actually, I'm going to lower this thing just a little bit.
Yeah.
It is a 6-month injectable that is going to be FDA approved here around mid-late June, that we anticipate, unless there's a delay.
Yeah.
But the idea is that once somebody has this shot, the 6 month, they just go in, they get a 6-month injection from a provider or a medical clinic, and then they're good to go for 6 months. They don't have to remember to take pills. And then, so if they're using Ozympec or losing weight or have gastro bypass or doing something that changes in the system, that's not drastically impacted.
Exactly.
If someone's on the injection.
Yes.
Okay.
But there's always a but, right? So when I'm teaching BDSM, I'm like, okay, so if you've got injectable HIV treatment, if you've got injectable PrEP, or any injectable really, that has to sit inside the tissue and slowly release, right?
Right.
But in BDSM, if you beat that area, then more blood flow goes into the area and it drops the drug concentration. So you have to be really, really careful if you're indulging in, say, flogging or whipping or beating. You don't get beaten over the site of your injection, because
I've never heard that.
Yeah, because your drug reserve will go down. Same with people who are using injectable steroids and stuff like that. That will also drop the levels of the drug.
Okay, so if I'm getting an injectable PrEP, or if I'm HIV positive and getting injectable treatment, you're saying I would not want to beat or flog or really have much to do with the injection site area, because you don't want to mess with how the body's taking the drug in.
Exactly.
For how long?
For as long as that's the injection site. So generally...
So let's say if I was getting an injection of PrEP today and then going to IML 7 days from now.
Yeah.
You're saying I still would want to stay clear of the injection site like 7 days from now.
I would say, as long as you want protection,
Oh.
you don't disturb that area. Leave it be.
Ever. The whole time.
Which is kind of good, because the injectable HIV treatments, we give them into the hips on the side. So it's one of those sites.
Yeah, but isn't that exactly the area that people sometimes get flogged?
I suppose, yeah. If you're using a long flogger and you say beating the arse, then that'll wrap around and it could tap those areas. So yeah.
Do people know this? Because I haven't heard this before. And I certainly haven't heard this in flogging communities or BDSM communities.
I am really trying to push this out, because there's a wonderful German researcher, Marta, I'm sorry, Marta, I can't remember your last name, but I bailed her up because she was talking about the Cabenuva injections, which is the HIV treatment, and I said, look, my clients indulge in BDSM and I'm worried about their reserve if they get beaten, and she goes, yeah, I'd avoid that. So, yeah.
Wow. Okay, so you heard it here maybe the first time, or maybe some of you know this on Tub Talks. If you are getting injectable prevention treatment, try to avoid getting flogged or really engaging
beating on
any
the
kind
side
of beating or flogging in the injection site area.
Yeah.
Forever, not just at the first.
Yeah, if they move the sites around, you can move that around as well. But you just got to be really...
So what happens if someone's like, well, I do love flogging and I do want to go to IML and I do plan to get my hips and my ass flogged and I want to enjoy that. What would you, like, can you move the injection site around, or can you...
I believe so. Look, the depot needs to be deep inside a muscle, and I don't imagine the drug cares that much which muscle it is. Normally we're aiming for muscles that aren't used too much, so on the side of the glute. I haven't asked about thigh injections or stuff like that, but thigh injections might be a good alternate. We'd have to find the data on it. And
Now, have
it's
we
not
seen
studied.
this actually happen in practice? Have you seen
I
PrEP
haven't.
or treatment drugs become less effective at the site of flogging
No.
because of flogging?
No, I don't think it's open to a controlled trial, at least yet. But
Wouldn't that be interesting?
if I had my way,
Okay, but you're saying based on your experience, based on the data we have, this is what you
Yeah.
recommend. These are guidelines you recommend.
yes, it's not It's not based in research, but it is based in. Well, if you beat a tissue, it's going to become filled with blood. It's going to become swollen. It's going to become red. It's going to expand. And all I could think when I heard that was like, well, I wouldn't want to fuck that up. If there was a drug that was keeping me alive, I would leave that alone.
To leave that. Okay, interesting.
And when Marta
Yeah.
said to me, I'd do that. Because
Interesting.
it is a very finicky thing that, like, it can be quite temperamental if you don't quite get the injection deep enough. It may not stick as long. But in good news, the tail of the drug is quite long, so we've got a lot of give in that system, but I wouldn't want to pressure the system too much. And particularly when we're looking at, say, a 6-month injection, you wouldn't want to fuck that up in month 3. Yeah. And
So 3 months into it, you don't want to interfere with the drug's ability to going in and being absorbed in the body, especially when we're talking about 6-month injectables for PrEP.
Yeah.
Wow. Now, what's so interesting is, like, I don't know any other doctors that are open and talking about this, both as a doctor and as a member. It's very hard to find people. So how did you get involved and specialize in BDSM queer health?
It's really weird. I remember being a young gay, and I had leather and all of that sort of good stuff. And I lived in Brisbane, which is really, really warm. And so I'd be overheating but I was a bit too young for the local scene. And I wasn't necessarily welcome with open arms. So, okay, that's fine. Many years later, went to Doré Alley and saw pups for the first time. And I thought, wow, that's really fucking cool. And there is an elder pup. Is his name Rex? I can't remember. But I met him and I had a chat, and we had a really lovely, sensible chat. And I thought, dude, you're kind of cool. Next day, went to Mr. S, bought my first pup hood. And
Your first
pup hood.
Okay.
And so this was pre the neoprene hoods, and so it was a leather thing. It was nice-ish, but it was a bit janky. And that lived under my bed for many, many years. My partner at the time really wasn't into it. And then I met another person who was a pup trainer.
Can you tell people what PUP is, if they don't know?
Oh, so pup is animal role play. So you might take on the persona of, say, a dog, or cats are quite popular. Hamster play, I don't know whether it's taken off, at least not outside of Hollywood. But you take on an animal-like persona. So my person that I was talking to, we somehow got onto a conversation about IVF and donating sperm. And the next thing you know, I was like, hey, I'm actually interested in this thing. And he goes, oh, really? Because I happen to be an expert in this thing. And so I learned about PUP. We created a pack. And then I worked so hard to separate my PUP life from my medical life, because I was worried about my license. I was like, if this gets out, I could lose my ability to work.
So you early on had to compartmentalize PUP life and pleasure from your professional persona.
Professional persona was, I do lots of prep and And it got to a point that it was really hard to separate the two. I had 2 YouTube channels going at the same time. There was a GPUP Alpha channel and there was my channel. And I also realized that this was a group of people who had never been exposed to sexual health education. So I started creating educational material like, did you know that if you put a tail in your butt, it's potential risk for transmission of Hep C, HIV, Hep B. So I just taught about, here's how to sanitize and clean your tail. Here's how to make sure that your tail.
Okay.
So it's like a butt plug with a long thing on it.
Yeah.
So I sort of said, look, here's how to do it. Get your nappy sand, clean it like a baby bottle. You're going to be golden. And I just kept on making those materials, really enjoyed it. Went to my first claw and ran a pup play class there, which
Plaza
was
conference.
gathering. Cleveland Leather Appreciation Week, which I love because they have a large educational section to it, which makes it tax deductible. And I love traveling and I love teaching, so I did that. And after a while, the persona and the doctor just ended up becoming the same person. So I was just like, oh fuck it, whatever. And then I teamed up with my local leather store, Eagle Leather, and BJ is the most kind, generous man, and he brought me in as the medical expert when he was teaching BDSM. So we would do whipping classes, we would do rope classes and stuff like that. And I was able to come and say, well, you know, if the rope's too tight at this part of the arm, you could push against this nerve, which will cause this injury. And over time, I've looked after patients who have, just last month, a patient got suspended on their arm and they crushed the nerve and they weren't able to use their hand. Thankfully, it repaired itself after about a month, but I was a bit scared because there's only one paper in the world that talks about this injury. And I was
And when is it?
Radial nerve palsy secondary to shibari suspension.
Okay.
So shibari is Japanese rope bondage, or kimbaku if you're going to be really specific. And when this person was suspended, they were sort of sideways, and all of the pressure of their weight went through one rope on their arm.
So suspended meaning they're hanging
off the ground.
Off the ground, and all of their body weight was falling on their arm. Against a rope.
Yeah, and so the rope pushed against the nerve, and that particular nerve is responsible for lifting up the wrist and a couple of movements of the hand. So it was a little bit. And the funny thing is, like, because of social media, I remember seeing some photos and I went, And then I got a ping on Facebook said, hey, I booked in to see you. And in the back of my head, I was going, I bet you I know why. And bada boom, bada bing, there they are with all of the radial nerve injury signs. And I sat down and went, okay, here's what we're going to do. And he got better. But
so you saw the person this happened to? The person, okay.
Yeah.
And over time, he was able to get use of his hands again and arms again?
Yeah. Okay. And it's the most common injury, other than falling down in cuts and abrasions. Yeah. It's one of the most common bondage injuries.
So then how does as a member of the community and a doctor, how do people prevent this? In other words, do you help people say, like, hey, if something feels painful, don't ignore it, or like, how would you advise somebody not to do damage?
I think the first thing is good quality education. People need skills. Now, HIV killed a generation of educators. We lost them. And I'm like, and so that really left a gap, and people were starting to make shit up. And I was like, we can be a little bit more scientific about this. And that was what I was introducing to pup play. And like, people would say, oh, eating from a bowl is such a good experience. And I said, yeah, it is until you choke. And then I've got diagrams, I've got pictures of a neck, and I show the anatomy of that, of how the neck works and how gravity helps food come down. And then I spin it around so they can see what actually happens if somebody's drinking from a bowl. Then you can see that the food just automatically can go down into the lungs. And so the risk of choking is quite high. So I talk about that. Choker collars, the amount of people who are putting electrical collars around their neck. And I'm like, oh, you don't really want to do that because there's nerves there that can stop the heart. So you don't
electrical collars.
Yeah. And even the pointy collars, just the pressure on the nerves in the neck can lead to a change in heart rate.
Do you give any guidelines about choking or asphyxiation during sex?
Yes, I teach.
Anything you could say here?
Make sure you have really good travel and make sure you have really good insurance, and that you understand what is going to happen to your loved ones when you're in jail. Because people die. There isn't a safe way of doing this. Solo breath play is responsible for many deaths. Within the rubber community, accidental solo breath play, where a chap had a suit and it was a little bit too tight around the neck, just enough to decrease the blood flow to the brain, and he passed out and wasn't able to get out of the suit. I I can't teach a safe way of doing breath play because I personally don't believe there is a safe way to do it.
Okay.
But it's very
You heard it, folks.
TikTok.
So you do not recommend people do asphyxiation or breath play or choking during sex.
I generally don't.
Okay.
No, because
That's good to know.
I just think, if you want that effect, if you want the effect of a rush to the head or anything like that, well, you could probably get that with Amyl. Or you could probably get that.
Meaning poppers.
Yeah, poppers, or you could probably do that. You could just sit in a squatted position, sit there for 2 minutes and then stand up quickly. You'll get the exact same effect. You might faint, so be careful with that.
I also think there's some advanced breath work that the Body Electric and some practitioners. I recently had a guest named Colby in the tub who talked about using just our natural breath work to accentuate pleasure. That we feel that euphoria, that there's a way to use our natural God-given breath to feel euphoric during sexual contact.
Absolutely. You can control the nervous system with your breathing. So with bottoming, you can teach people about box breathing. Breathe in for 4, hold for 4, breathe out for 4, hold for 4. And that increases the parasympathetic nervous system. I'm sorry if I'm nerding out, but I get so passionate about this that can naturally decrease blood pressure, it relaxes muscles, makes penetration easier. There's a lot of little biohacks within medicine. If you're a kinky fucker, you can learn a lot in medicine. I should have gone into anesthetics because that's where all the kinky fuckers are. So bless their hearts. I love anesthetics. I wasn't smart enough to be an anesthetist, but bless their hearts.
What are some of the other things people could learn from medicine or learn from just our natural body's capacity for pleasure?
Oh my God. For the love of all things bright and holy, learn how an arse works.
How does an ass work, George?
Well, funny you should ask. I believe that there are a number of muscles of the arse, but there are two main players. You've got your external anal sphincter, that one you can control. You can keep it shut. It's not easy to open, but you can control that. And then you've got the internal anal sphincter, which is a mystery box because we don't control it with our brain. It's outside of that range, but it's a little lock mechanism. It will open with gentle pressure and it will slowly open up. And the biggest cause of anal fissures that I see in my work is tops who are worried they're going to lose their erection and they barge into an arse. They don't give the arse time to relax and open because everybody thinks it's a ring, but the arse is actually a tube. It's not a ring. So just because one end is open doesn't mean the other end is open. So I know that Dr. Carlton teaches the quadrants, which is really great. There's my friendly proctologist on YouTube. He talks about, he seems very enthusiastic, but I'm not quite convinced he's gay teaching yet, but he's very anal positive. He talks about swirling. My variation is the tap. So I teach bottoms, if they're opening up for the first penetration, lay your top on their back and tell them, I know what I'm doing, I'm a professional, you lay back and have a wonderful time. Tops are worried they're going to lose their erection, so you put lube on the head of their cock and the rest of it. Lube yourself up, be ready, be breathing, be not in pain, not in stress. Stress, pain closes the arse really, really fast. And then the bottom can lower themselves, this is a simulated penis. The bottom can lower themselves on that and just tap, 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 and that will create the stretch in the anal sphincter that will allow it to open. And then slowly they can start the penetration. I teach doctors this stuff because people, every now and then you need to get a finger up your butt. And it's a very important exam. Please don't carry on like a pork chop if you need a finger up your butt because it might save your life. I've picked up multiple anal cancers.
Wait, you're saying for doctors to make sure they're doing finger exams? Or are you saying for patients to do that during sex?
Well, if you're HIV positive, you are 100 times the risk of developing anal cancer later in life. After the age of maybe 45, 50, you should be getting a finger up your butt every year.
Okay, but back to pleasurable anal sex.
Pleasurable anal sex. It will slowly open up and then you're going to get the pleasurable sensations. And then from there, once the penetration's happened, everything's great. But sometimes if a top's really worried they're going to lose their erection, they will barge in, and then the muscles will clamp around the cock and keep the blood in there, and then they just sort of shuffle a bit until everything starts to open up. But the arse will open. The arse will open, and I believe that if you give it time, lots of lubricant, if you're using water-based lube, keep on replacing it because the arse absorbs water. I'm a big love silicone-based lubes. Although sugar-based lubes are good if you don't mind slipping around your house for the rest of your life. There is not enough salt in the world to get rid of water-based lube.
The silicone really works for me.
Love it.
Yeah,
love it.
It gives a very natural feel. But I think so. All of that is to say that first position that you mentioned. So the top
Cowboy.
flat on his back, bottom sitting, and complete control over the speed and the pace of the penetration.
Speed, depth, rate.
Right.
They can.
And from my point of view, just psychologically, that adds a lot of pleasure to it. Because at that moment, the bottom is saying, okay, I can control this. I can control how much, how little.
Yep.
And it's okay when they feel comfortable with the partner to say more or less or start or stop.
Yep.
That gives our brains the signal to say, okay, all systems clear. There's no danger here. Relax and enjoy the ride.
Exactly.
Because if we're not, in my experience, we're not doing that here.
It's
Everything
not
down
work.
there is going to
Not
be
gonna
clenched and
Exactly.
painful and then if you use poppers, which sometimes is a choice, but if you're using poppers to do this part of the job, sometimes it does lead to, I think, that experience where the key goes in too quickly and your body's not able to recognize, not ready yet, ouch, slow down, stop, wait till you go into that second hole.
Exactly.
So it's a very tricky mind-body experience.
And I think, again, we have generations of people who've never been taught this stuff.
Right.
Cleaning out.
Okay, so that's next on my brain's list. Let's talk about it.
There apparently is only one Bible on this, one PDF that's going around the world that teaches people how to clean out.
What is it?
I can never remember the name of it.
Okay.
It's the PDF is held on a WordPress site, and it's a good piece of data, but not everybody finds it. When you buy a douche, there is no instructions in the damn box.
Yep.
So, and all of these people, and this happened to me. I was cleaning out, and I thought all of the water came out until it didn't, and it was just like, and
every bottom has been there.
we've been there, done that, and tops. If you are going in the lolly store, there is going to be lollies. That's where the lollies come from, right? So
The lolly?
sweets.
Okay.
If you're going in there, don't be fucking shocked if you see poo.
Yeah.
It's happens.
Yeah.
You can clean up and you can go about your day. But I think sometimes like bottoms get shamed and all that. Oh,
They do.
You know, all
It
you have
happens.
sometimes to start the ice and
People in the tub have talked about that. In my therapy practice, people talk about this.
Yeah.
Where they get shamed, or if they're in a certain circle, now they're going to be ostracized or shamed.
Wow.
It's terrible. It's like terrible mean girl shit. Literally. That it's like, if you have an accident, which happens to all of us, if you accidentally shit or bleed during anal sex, you might be seen as someone like, there's a stigma around that.
Yeah.
And
it's about learning the sensations of your body and learning the timing of your body.
Right.
And again, basic physiology, gastrocolic reflex.
Yeah.
So when you eat food, it stretches out the stomach, and then there has to shuffle. The shuffle has to happen. All of the food has to move along. And for many people, within 20 minutes, that's when they're going to do a poo. It's like, good. So I never say, don't dinner date. Dinner date is the worst situation. You fuck, and then if you like the person, you have dinner.
oh my god, I say that first.
Yeah.
I mean, fuck first.
Fuck
and
first.
actually, Dan Savage was the one where I got that from.
Really?
Yeah, he was, I don't know if he came up with it, but it was just that idea that if you really want to enjoy yourself, and you really want to get to know someone, fuck first. Have a wonderful experience. Then go out and have a heavy dinner. Have all the food. Have all the carbs. Have the wine. Have the dessert. Because then you don't have to worry about what's going to happen 20 minutes later.
Exactly.
Right?
Exactly. I have done that. I've had a bottom coming around, and I had in my head what was going to happen, and then I said, okay, let's go quickly grab a coffee and some breakfast, and I get exactly what I paid for. So it was just like, And all I could say in that situation is, I'm just cleaning up, dude. We did alternative things, and I just went, yeah, it's my fault because I took them out to eat. So it was totally on me. It wasn't on the bottom at all. They can't control their physiology. The body's going to do what the body's going to do.
Right.
So,
Yeah, I don't know about in Australia. In the US, so much of sex is framed around romanticism and the should. That if you're, now again, I think this has changed a lot, especially in the last 10 years in queer communities and sex affirmative connections. But I think the thing used to be, like, if you like someone, if you love someone, you should go out on a date with them, and that date might involve dinner and dessert, and then you gotta figure out all the anal sex stuff. And it was like, but that's sort of what like, you can have sex as long as it's framed in the purview of romanticism.
Yeah.
And hopefully, I don't know if you feel like that's changed or that's coming around, but I feel like in the queer community, there's some sort of like, no, if we really want to have good, heavy sex without fear of shit or blood, we're gonna do the fuck first.
Yeah.
Yeah.
And this is where I think U equals U, where PrEP has made a massive difference because we're not aiming for monogamy. That's, and I'm not monogamous, and I've got multiple partners who I love all dearly, differently. Everybody brings something different into my life. And I don't go to one supermarket to buy stuff. Bread and meat come from different shops. So why would I stick with one model?
Right.
And, when I was separating from my ex, there was a lot of, I'd say, well, this person's my master, and but I'm in control of you. Actually, no, you're not. You're not in control of me. So anyway, blah, 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 blah.
That's great.
But I really think now that we've got this amazing ability to prevent the big stigma, the big thing that we literally don't have to worry about HIV as the elephant in the room. We can release ourselves. And I when I was fucking in the 90s, always in the back of my head was, what if it breaks? What if da 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 da? And which was kind of weird because I was going to saunas and having I worked in a fucking sauna. I still fold towels the same way to this day.
Oh wow.
The body line folds. But that group of people were sometimes treated quite poorly and like, oh, you just want to have sex. I'm like, yeah, it feels good. Yeah. I bet you don't piss in the shower or you don't have a wank before you go to sleep. Nobody else does that. So calm down.
So then what do you recommend as far as effective, healthy ways to prepare for anal sex so that one can enjoy this experience and reduce or minimize the possibility of shitting during anal sex?
Well, I think the first part is understanding that for almost most of the day, that part of the arse is empty. And the rectum is about 12 centimeters long. The average Australian penis is 10 to 12 centimeters.
So how much is that in inches?
5 to 7 inches is an average penis in Australia.
Okay.
I believe it's similar in America. No? Okay. What are the magic numbers here?
I think it's larger around here. I don't know because I don't measure, but it's definitely in this neighborhood is much larger.
Well, lucky you. This is what you happen when you move out of a co-op. So, control.
Yeah. I mean, again, I don't measure, but I would say that their penises, for me, go up there. And there's certainly partners I have or partners I've had where that's
banging against.
it goes, it gets up there. It taps up to that. So how...
I'm going to check out the friends list on Facebook.
Yeah.
Cross-referencing is important.
Go on Scruff or Grinder around here. Yeah. Williamsburg, folks, is a great place. So what do you recommend for people who want to do this safely and effectively?
Well, I think first be aware of what's potentially on the table. HIV, potentially on the table. Then you've got your chlamydia, your gonorrhea, and your syphilis. They're endemic, they're always around. So you've got PrEP or U equals U for HIV, and then you've got DoxyPEP.
Yes.
DoxyPEP, great for chlamydia, great for syphilis, hopeless for gonorrhea.
But okay, I'm gonna push back.
Okay.
I'm pushing back on you.
I can say.
I think the data is mixed on gonorrhea, and I can only tell you anecdotally that I had gonorrhea on a pretty regular basis. I had a pretty good run with gonorrhea throughout 2015, 2016. Once I learned about doxycycline's effectiveness in preventing STIs through Jean-Paul Molina's research, and I saw that at Croy, and I started using that myself. I have had no gonorrhea transmission since 2017 with doxycycline.
Nice.
So anecdotally, I think it does. It's not like perfect. And I think the data has not shown in any way that it is as effective as chlamydia and syphilis. But if we're talking about the quality of harm reduction, even if it's only 50%, 40%, that's still pretty damn good.
So my website currently quotes the original data, which was 86, 85-ish for chlamydia and syphilis, and about 56 for gonorrhea.
Yeah.
But then was recent data out of San Francisco where that gonorrhea number dropped quite a bit.
Yeah.
But, and this is the big one, London is currently vaccinating as many gay men as it can with meningococcal B vaccine.
Ooh, why is that important?
Because there is a cross reduction. Not only will you not get meningococcal B, which is deadly, and if you were going to large events like IML or Dore Alley or White Party, whatever, get your meningococcal ACYW and B vaccines because they sporadically happen and they're deadly.
Yes.
So good to get vaccinated against that, but there is a reduction of maybe about 20% against gonorrhea. Not perfect on an individual level, but if you vaccinate a large group of people, like the gay men of London, then you will see gonorrhea numbers coming down.
Right.
And that's really effective. Because 2 shots of meningococcal B will last you the rest of your life.
Right.
And that may mean adios, adios gonorrhea. And the other really important thing for reducing all of those infections is, for fuck's sake, make sure you get a proper fucking screening. Throat swab, bum swab, urine and bloods. It's the amount of people who come to me and I got my testing at my GP. Really, what did they do? Oh, they did an AIDS test. And I said, well, I can't see any Kaposi sarcomas. I agree, you probably don't have AIDS. And you're HIV negative, so there's no reason for you to have AIDS. But what about your throat? What about your bum? And a lot of people, they say, but I've had nothing up my bum. And it's like, but if you had a finger, has anybody licked your bum? Because the Melbourne was where they discovered that gonorrhea is in saliva and can be transmitted throat to throat. There was a large music festival, a lot of people were pashing each other, and we couldn't work out kissing.
Okay.
Deep
tongue kissing. Okay.
They were all having a good time, and we couldn't work out why there was so much gonorrhea coming from there. But Vincent Cornelisi in Australia, wonderful researcher, put it all together and oh fuck, it's being transmitted through kissing.
Wow.
So, and even if you're monogamous but you've snogged 1 or 2 people at the pub, it's still worth getting your throat swab.
Yeah.
So get that.
I cannot tell you how many times I see in the International Prep Facts group on Facebook where someone's like, okay, I went to get tested because I wanted to do all the right things for STI, and I peed into a cup and I'm good to go. And we asked them, well, what else did they look at? Like, no, my doctor said it was fine. I peed in a cup. And I know that's true because that used to happen to me. I never, ever got offered a butt swab until I was in my 40s.
Wow.
So I started using PrEP. So in this country, PrEP protocol and 3-site testing was adopted at the same time by the CDC around 2014.
Yeah.
I didn't know all those years when I was peeing in a cup that it wouldn't cover my butt.
Yeah.
And no doctor ever told me that.
You might have like archaeological gono in the butt or something.
Wow.
Chip it out off the edges.
It could be. But isn't that like
that's
crazy?
not our fault.
That was never recognized.
Well, most doctors don't even know that shit.
Right. That's why we try to tell them.
I was teaching at a large medical thing. I was teaching how to do gay men's health. Now that was an experience. Some dude sat at the back of the room with a newspaper across his face, blocking me out. And were it not for the fact that they were paying me good money, I would have said to that guy, dude, you're not interested. I would prefer you leave the room. If you don't want to hear me, I don't want to see you. Go. which is unfortunate because he's the one who needed the information. But I had a lady swear to me black and blue that if somebody had chlamydia in their throat, it would definitely be in their urine. And I had to say to her, is it possible to have oral sex? And she goes, yes. Is it possible to have oral sex and not vaginal sex? Yes. Then why would there be chlamydia in this person's urine?
Right.
And you could see the clock, and then she was sort of,
So, right, so just to be clear, correct me if I'm wrong, what we're talking about with chlamydia and gonorrhea are what we call very localized bacterias. That means they can exist in one place but not be in the other.
Exactly.
I can have gonorrhea, I can be negative if I pee into a cup for gonorrhea, but it could still be, the bacteria could still be active in my butt.
Yeah.
Which means if I top, I won't transmit it, but if I bottom, I will or could.
Yeah.
Right, so that's why we need 3-site testing. And this is also in the US why once they started adequately testing well with CDC protocol around 2014, and they started doing 3-site testing on the sluts who were getting PrEP, that's when they started seeing, for the first time, all these exponentially high rates of STIs.
Yeah.
Not because they were new because of PrEP, but because they had always been there and never been tested, treated, or documented before. But that got conflated with promiscuity. And
just
you know, the
Yeah.
fact that PrEP sluts are, you know, creating and spreading exponential, we're taking over the world with gonorrhea.
Yeah.
So, sorry, that was...
If I was going to take over the world with gonorrhea, I'd do it in a much better way.
Yeah.
First thing I would do is make sure that people know that they have the infection, because you can have it in the throat and you can have it in the bum and have no symptoms.
Right.
So, yeah, so that's why we look.
Right. Okay, now back to pleasurable, deep anal sex. If you
Deep.
are getting ready to bottom for a person or multiple partners who may be of a larger size,
Sure.
how would we go
I
through
think
that?
if you're just doing dick and butt sex, the only section you need to clean is the last section, the rectum. So, anatomy for young players, when the arse, so this is the front of me and that's the back of me. So my butthole and yours too, in fact, everybody's butthole, and initially points forward towards the pelvis, and then it scoops back and follows along the sacrum and goes up. Then about 14 centimeters later, it projects forward and across, right? So when you're douching, you want to fill that first part with water, but not the next part, because if you fill the next part, it spills over. And if you're cleaning out and you've seen rivers of brown, that's generally because you've spilled over and put too much water. Most people, they'll go to a sex store and they'll say, I need a tool for cleaning out. And the salesperson will go, well, I know what you need. And they will sell like a shower shot or something like that. With a shower shot, you've got to get scientific, because the volume of the rectum is around about 150 mils. That's what, 5 ounces of water. Assuming an ounce is 30 mils.
Okay.
5 ounces of water. More than that, you're most likely going to spill over. So if you're using a shower shot, how do you work that out? So my recipe for a shower shot for my body is that I know that I turn the shower shot on, body temperature water. If you have the ability to set it to whatever degree is body temperature in America, 37 in Australia in Celsius. I'm not sure what that is in Fahrenheit. 90 something?
I don't know.
Something. Not too hot, not too cold. Goldilocks.
Right.
Too cold.
Goldilocks.
Yes. If it's golden, you probably should be doing this protocol. So anyway, 5 centimeters of water pressure is enough to fill the butt. You don't have to put the shower shot up into your ass. And 5 centimeters of water pressure just gently against the butthole is enough to get the water in. And then what you do is when you first get your shower shot, get a measuring jug, right? And put 5 centimeters, and then put the measuring jug underneath the shower shot. And then you count until you've got 150 mils. So for me, that's a count of 4 and. So I can go 1 and 2 and 3 and 4 and. Then I displace, and I know how much water is in my butt.
Okay.
So that's the recipe for me. But for other people...
And then do you keep it for a minute?
I do the dance. So I do a little jiggle.
Uh-huh.
The I'm about to get lucky dance.
Uh-huh. How's that go again? Okay.
Because there are 3 plates within the rectum called the haustra, and shit can get stuck on that. So you want to dislodge that with a little bit of jiggling of the water, and then get on the toilet and you can do your box breathing to gently push it out. Don't You don't have to squeeze it out. You can just gently breathe it
So we're
out.
talking like 5 ounces of water, is what you're saying?
5 ounces. Yeah, 150 mils is generally enough for most people. But maybe start at 100 mils and then see how you go.
Okay.
And generally I do that 3 or 4 times, maybe 5, if I've been having enough fiber in my diet and that brings all the food together. Sometimes it doesn't work. And
Yeah.
it just
What about like traveling? Like
for traveling.
Yeah.
Look, there's a water bottle right there.
So this water, this is 20 fluid ounces. When it's filled.
Okay.
Right now it's about half filled, so it's about 10 ounces.
Cool. So with that, you can get an attachment that will screw onto the top, and you can squeeze that up. And if you want to go to CVS and not feel stigmatized, you can buy the sinus rinses. There's a neti pot. It's like a neti pot, but you can squeeze it, right? And it's called a sinus rinse. And you fill it up with water, you put it up against your nose, and you squeeze it full of water. It sounds familiar, right?
Yeah.
So there's that. But also you can get the little travel douches as well. Highly recommend the ones that are made of silicone, not the hard plastic ones, because that can scratch the ass on the way into the butt.
So for me, I just basically keep it simple and use the fleet enemas, not the solution. I empty that out.
You throw that away.
Not the solution, but just the bottle itself, which travels really well. It's pretty durable, as long as it's not exposed to heat. It's a pretty durable thing that helps me to travel. And then I don't know how much water is in that, but that's just, I sort of just repeat that. But sometimes it's a given, it goes fast. Sometimes it doesn't go fast. And I'm 54, I still cannot figure out the enigma of the quagmire of the mystery that is my gastrointestinal system.
Less at all.
You know, it doesn't seem to be consistently reactive to any specific foods. Sometimes, I moved to New York so I could have more pizza. And sometimes that seems to be good. Sometimes my body does not like it. I don't know. I wish I knew.
Cleaning out after a big meal of KFC or McDonald's or whatever, that's fiber hell. It just keeps on coming and keeps on coming. But I reckon if you get 2 or 3 pieces of fruit, lots of vegetables in your diet, lots of raw, fresh stuff, that's perfect. You'll get beautifully formed poos, and just wash out.
So for the fleet enemas then, would you say it's the same thing? Fill it up, be gentle,
1 good squeeze,
do the dance,
and then expel. I'm not a waffle stomp kind of guy. There are some people when they're douching, they just shoot it down the drain in the shower, and I'm like, ugh. No, I do it in the toilet. But if you're a waffle stomper, good luck to you. But
a waffle stomper?
Yeah, so you stomp the poo through through the grate.
That's
why it looks like a waffle.
Okay.
So
I never heard that.
Oh my god.
Oh,
I'm so glad I'm here to educate you.
I'm learning so much.
I honestly thought you were going to be teaching me shit, but here we go.
No, I'm learning that.
Oh my god.
Okay.
Yeah, so for that's perfect. If you are doing extended play and all of that sort of stuff, that's where the gastrocecal reflex comes in. And you do have to think about, when am I going to be eating? I'm not an expert in fisting and I'm not an expert in deep cleaning, but there are many people who are fantastic at it and great educators on that. But it's a much more involved process.
How do you feel about using Imodium or anti-diuretics to enhance anal sex, or if one's going to IML and planning to be in a group situation for hours at a time?
Pendulum swing. So what you stop will have to start again. And so you're going to have this jolting carriageway of... So when you stop the gut from moving, the gut still does its job. And like the large colon, its job is to absorb water. So what's going to happen with lots of Imodium is that all of that poo is sitting there just getting drier and drier and drier. So eventually when you do poo, it's not going to be fun. That could be a potential tearing fissure situation on the way out.
Right. When we say fissures, we're talking about those little rips that can be really painful.
Very painful.
Yeah.
So I'm always big on, if you can get away without Imodium, I do it. And for the people who are using the semaglutides, the Ozempics, the Wegovy's, the whatever the other one's called, Manjaro, I think it is. A lot of my bottoms say to me that it's amazing because it slows down the movement of the gut. So it gives you a much bigger window for clean out. as well.
Oh, so the diabetes meds we're talking about, the weight loss.
The weight loss drugs.
Yeah, the weight loss drugs.
Because their job is to slow the movement of the gut, it does actually give you a wider window for staying clean.
Wow.
You might even get away with a waffle before.
Wow.
Dessert before dessert.
I'm going. Next time I go to Waffle House, I'm really going to be on high alert.
I need to get to Waffle House just for the flights.
You need to see a Waffle House while you're in the US. I don't know if any here in New York, but in the South. There's a lot.
I hear they're really rough and ready. That there's fisticuffs and all sorts of stuff.
It's good. It's worth it. It's good. But now I'm going to think very differently about it. Okay. Now I forgot my next question. So other things you've talked about have to do with, now I remember my question. Have you been hearing or practicing much Botox for the butt?
In Australia, it's a rare commodity.
Okay.
And I was having a discussion with one of the leading pelvic physios, Stephen Lavender, last night.
And he's a guest in the tub. So by the time this airs, that interview will be up.
Yeah, go into the back catalog. Stephen is amazing for the stuff that he's doing. I was always worried about Botox, that it would totally knock out the function of the internal anal sphincter.
Yeah.
And when I learned about this, I talked to Stephen about it, and he'd go, no, this is going to sound technical, but a normal butthole has a certain level of pressure in it, and say 60 is the normal level of pressure. And I thought with Botox, the muscle would be completely flaccid and unable to work, but all it does is it drops that pressure by about 15. So you've still got a perfectly functioning butthole, but it's less tight.
That's classic.
Yeah, it's more likely to be open and more likely to be encouraged to relax. That reflex of it slowly opening will work better. So it sounds like it's really amazing. For people with fissures, Botox in the butt is amazing, because when you've got a painful scratch in the butt and it's bleeding and it's painful, two things happen. People don't want to do a poo, which means the poo's harder and more likely to cause more damage. But every time they do a poo, it's painful, so all of the muscles clamp down.
Yeah.
With the Botox, it relaxes the muscle, and that allows more blood in to heal, and the edges of the cut to come together, so they can oppose and heal properly.
Wow.
So yeah, it's a big thing. And watch this space, because I think Botox or Arstox, or I'm not sure what Botox, isn't it? Is that the word?
I mean, Botox is what we're currently using.
Okay. Well, yeah, that.
Botox.
Yeah, that
maybe
is not just for people who are, wanting to get fisted or double fisted or whatever. I think this is for people who initially have painful receptive anal intercourse and where the muscles are really, really tight. This gives you an opportunity at a play space to learn those sensations of relaxation and allow it to open. Wow. So I think that is going to be amazing. Watch this space. But Australia's weird that it's unlikely that, I was always thinking there's no way that the government would pay for PrEP, but they did. And so they may very well pay for buttocks. Maybe you may have to fudge the numbers a little bit and say that this person has a very tight anal sphincter, but a tight anal sphincter is a tight anal sphincter, whether you're using it for pooing or fucking.
Yeah.
So, but I think there's a lot of scope in there, and it's great because the previous alternative was an operation that cut the muscle, and that's irreversible and not great.
Right.
So.
I think another thing that we don't talk about in terms of preventing fissures is nails.
Oh my God.
Nails.
Handshake.
And I say that just like back in April, I had just a fissure, and it was like 5 days, but that was 5 days of pain and 5 days of being completely out of commission sexually. And I'm not totally sure how it happened, but I'm pretty sure it was a nail situation where someone went up there. And I usually am cautious about fingers in my butt for this exact reason. So, because a lot of these guys, I don't know, always clipping their nails, or it could just be a weird thing where it goes up or touches something and it just cuts in the wrong place.
Jagger or something. I do my best to keep my nails nice and short and filed down, but Yeah.
But if you're gonna go up there,
Yeah, you want to make
Cut
it
your
as
nails.
smooth as possible, as
Yeah.
lovely as possible. And if it's a toy, then make sure it's got a big base on it.
yeah.
Please, please, please make sure it's got a big base on it. Because when they fall up, they can be hard to fall out. So
Basically,
toys.
basically. So that meaning you can,
yeah,
they don't get lost up there.
yeah. So if you've got a toy, make sure that there's something to stop it from falling up into the butthole.
Yeah. So what else do you think gay men or queer men would benefit from knowing? What else would be helpful in terms of growing older and celebrating our bodies and understanding the meaning of pleasure in a healthy way?
I think the first thing is have a doctor that knows you and loves you. My patient base is the most wonderful group of people.
Mm-hmm.
I know them inside and out, and I know when they're not well.
Yeah.
And so if somebody comes in and there's suddenly things are wrong, I don't just do sexual health, I don't just do PrEP, but I also do mental health and all of that sort of stuff.
Wow.
And
Because in the US, that's not really common.
that's terrible.
I know.
And if people are coming in for PrEP, I always make sure check their blood pressure, do the simple things, get your heart checked, get your cholesterol checked, do all of that sort of stuff. And that will give you the longevity and prevent other illnesses. But I think we need to get past this. And at the moment, I feel for the people of America because you are in a tight situation at the moment where there's pressure against minorities. And if you think that they're going to stop at the trans folk, you are very mistaken. They've already done raids of sex stores to get rid of amyl. They've already made PrEP more difficult to obtain.
Yeah, during the first Trump administration, they already raided and arrested the employees of Rimboy.
Wow.
That happened the first time.
Yeah, and sex workers are great people. They know what they're doing.
Yeah.
I see so many heterosexual people worried about HIV after they've been to a sex worker.
Yeah.
And I'm like, dude, you went to the right place.
Yeah.
The sex workers are amazing.
The odds are in your favor.
They get a regular screening. The
Yeah.
average punter in Australia is lucky to get a sexual health screening every 2 years.
Yeah.
So, yeah, sex
So
workers are
what
great.
else? So if we don't have access to that kind of loving, informed medical provider, what else can gay and queer men do to own and be empowered about their bodies? Or what else would be helpful if they're going to IML or going into a play space? What other things do you really, really, really wish they knew?
What would I wish that they knew?
Like we've been talking today about, well, I think that part about on-demand PrEP, if you're on weight loss med, is very, very helpful.
Yeah.
Really understanding your butt, cleaning out in a way that's healthy, that's actually successful. What other things can be can enhance your
If I was
experiences?
to if I looked back on my life, I wish I either had the insight or the honesty to know what I liked. I like bears. I like big, chunky guys. I love jiggle when it walks, all of that stuff. I lived in Germany, one of the most sex-positive places in the world, and I was walking down the wrong streets. I should have been going to the bear bars and just lapping up all of that honey. So I think know what you like is really a good thing. Know what pleasures you, and then don't feel embarrassed to tell people what pleasures you and say, look, I really like being fucked in this way. If you do this with me, you will get the most amazing experience out of me, and you're coming for dessert. So I think being honest with yourself about what you really like. If you really love being a cum dump hidden in the back of a bar that's just there to be used, then own it and be fucking proud of it and be the best cum dump that you can be. So I think that's important, and I think we need to develop stronger social networks that aren't exclusively based on sex. That sometimes people can be really mean to people they don't find attractive, and we need to love everybody and understand that we've all come from backgrounds that were most likely not the most pleasant, and we can create environments that are really good and supportive. So I meet a lot of really lonely people, and I will tell you now that loneliness is not cured by location. A lot of people say, I'm going to move to New York because there's so many people, I will absolutely find the best person. And I'm like, you might. I wish you the best of luck, but it's a long trip. So I often say to people, they want to meet a partner or somebody that they can feel really connected to. I often say, well, what's something that you really enjoy, and can you invite other people to do it with you? Because even if you don't find them sexy, you've got an activity that you can do together. Knitting, I knit. So I've got a crew of gay guys that we knit together. Sure, I would love to have sex with a good portion of that group, but I don't care if I don't, because at the end of it I get a hat or a jumper or whatever. And it's a fun activity. And when you bring people together, that's when you learn stuff like, oh, did you hear about such and such? He was really mean to our friend. Please be aware of that. Or like, oh, have you heard that there's this new disease going around called, I think it's monkeypox or something, and it's a rash. There's a site down the road where you can get a vaccine. Why don't we all just all go and do it after we met up for coffee? So you can learn all of that intel by having friends. I think like a lot of down low gay people get arrested and caught in stings because they don't have a social network to tell them, oh, by the way, the Port Authority toilets are just crawling with police. They don't ever hear that because they're not picking up the gay newspapers or anything like that. And if you live in outer buttfuck west, then maybe get online and start meeting some friends that way. But I think as we get older, the dynamics of the neurology of pleasure change. We move away from the thrill of the chase with dopamine, and we move towards the sense of belonging and love with oxytocin. And as we get older, we just lose our dopamine receptors. Facebook probably steals dopamine receptors from us every day. And oxytocin is about feeling secure. It's about feeling connected and loved. And I think as we get older, we appreciate the oxytocin more. The cuddles after sex are just as important to me as the rip-roaring sex in the sling. So,
can you just say, like, basically what the difference is between dopamine and oxytocin?
Yeah, sure. So with dopamine, the brain hormone of anticipated reward. It's the thrill of the chase. It's the orgasm.
The hunt.
The hunt. But also the thrill of, I caught that. There was that sexy guy that I've been eyeing off for the past year, and we met and we had a really great time. Whereas oxytocin, the easiest way to demonstrate oxytocin is when they hand you a puppy at the pet store. Oxytocin is released through breastfeeding, it's through touch of the skin. That's why they hand you the puppy to hold. Massage, absolutely.
Bathtubs,
bathtubs, all of that nice, sensual holding, all that stuff. And oxytocin is that love hormone. It's that I feel safe with this person hormone. So, and I think everybody needs people that they can feel safe with and develop those networks. I am very, very fortunate in Australia. I have a tight, chosen family, and we all feel safe with each other. And look, to be honest, in Australia, real estate's so expensive. A tight social network is the only way you can get into the real estate market. So, you will often see, lesbians would buy a house and renovate. The gays are getting into that too. But it might be a group of 3 or it might be a group of 4, because that's what you need to get a deposit and to be able to get a loan. So, so that's the main differences. But I think as we age, it's the relationships that are going to be equally as important as maybe the one-off stands at a sauna.
Beautiful.
I enjoy the thrill of the chase at a sauna, but it's usually the conversation afterwards I enjoy equally as much. So
fascinating.
Oh, and that's the other thing, is that I think a lot of us, because we grew up in a situation where we couldn't be open, we didn't learn to practice those skills of nourishing friendships and things like that. So practicing that stuff, I think, is good.
Right, and it is a practice. It's not a one and done. Building community, creating family is an ongoing lifelong process.
And it's hard when you've got a busy life, and at the end of the day, I'm tired, and I have to keep on reminding myself, well, if I'm sitting on the couch feeling lonely, I've got umpteen friends who would love to catch up for a meal, so I just need to reach out and access those people.
Right, so to know that you have agency, right? And I think that's a really important part of enjoying life as we get older, is to know you have agency. So if I'm alone, almost all the time, if I choose to be alone, it's because I choose to be alone. If I want to go out, there's people. I've created family. I have literal family. I have created family. And if none of them are around, I know that I can go into a social space, and if I'm just open, if I'm just being open and kind, kind to myself, kind to others, I'm generally the kind of person who people want to talk to, or, you know, sometimes I have to be careful because people sit down next to me in a bar and tell me their life story. But I know that, like, okay, if I want connection, through physical proximity, I know how to do that. I also know how to be in this living room in my house, completely alone, and feel abundantly connected to living beings in the physical and spiritual world because of how I practice. That my sense of connection and meaning is not tethered solely to having physical proximity to other people. So that it's a both and. Yes, I need the oxytocin, and I need to be around people, and I definitely benefit from having the space to be connected in an infinite way. But everyone, I think, has to find that balance for themselves and understand that they have agency in how that all plays out. I think when people feel lonely, or they talk about feeling lonely, it's when they have a perception of isolation, when they're, you know, perceiving connection solely by the physical, and when they are, you know, a lot of times, to be honest, people who tell me they feel lonely are miserable to be around. They're mean, they're petty, they're insulting, they do the judgmental thing. They're not approachable in social spaces. So it's like, okay, you act that way, it becomes what it is.
And as a young gay man, I'm not proud of how I was. I was a bit bitchy, and to be honest, I was lacking social skills. And I think evolving through medicine, I just had to learn that bulldozing might get the road built once, but nobody's going to come back. That you've got to
say bulldozing will get the road built once.
So, like, say for example, customer service. There are people who immediately go Karen, and they're going to go, well, I'm going to get you sacked because you put the soup can in the bottom of the bag when I told you it should be in the top, and they just go fucking full on. Instead, we could, you know, you could just rearrange it and shut the fuck up, and don't be an asshole to somebody who's probably paid a terrible wage. And, you know, having empathy for the other person. So the person that's telling you your life at a bar, clearly this is one space where they felt safe to tell that information to somebody who appeared like they weren't going to be horrible to them. And that's sad. That's sad that that's the only opportunity a person had to share their story. So everybody's got that story, and I think, you know, at events like IML, it's a really amazing opportunity because you've got a craft group. You've got a group that is fetishized one thing or another that fits under that wonderful umbrella of BDSM. And, you know, I'm not going there to yuck other people's yum, but I'm also sort of understanding that when I was younger, I didn't particularly like sushi, but shit, I like it now.
So our desires and tastes and pleasures can evolve over time. And I definitely have felt that for myself and seen that in many people over the decades of our sexual expression. Right? And then people are just open. They often find that something or someone you may not have desire for when you were younger is like on the menu now.
Absolutely.
And that can be a wonderful part of growing. Right? So I think there's a lot to celebrate about getting older. And I love that you've brought in so many factual health-based things to help us think about sexual health and pleasure and community and connection. And you're continuing to put that out there in a way. And I love that you don't have to compartmentalize your identity as part of our community from your professional role. That those are actually a beautiful both and.
When I shat my pants really bad. I got invited to do a documentary in Australia on animal role play. I remember doing it, and then I remember going, I am going to go in front of the medical board, I'm going to lose my job. And it played and I gained patience.
Wow.
People went, oh my God, thank God there's somebody who's doing what you're doing.
Yeah.
Yay, I was happy about that.
Yeah. So that can be part of the experience as well, of getting older, of having expression, of trusting ourselves to be who we are, show up.
And to also show up as you.
Yeah.
Don't pretend to be. Don't steal somebody's photos and use them on scruff. It's
that's
never
not a
going to
good
play
idea.
right. Be you.
Yeah.
Be the best damn you that you.
Yeah.
Because you never know what a person likes. And if you're upfront and honest about what you like, there's a wonderful sex educator, what's his name, Dr. Ross Glover. Teaches mainly from a heterosexual perspective, but he's got a book called No More Mr. Nice Guy, where he talks about unconscious social contracts. Say, for example, if I hold a door open for somebody and somebody walks through the door and they don't say thank you, part of me might go, well, that person's a fucking asshole and I held the door for them. They owed me a thank you. But that was a contract that I made in my head that the other person wasn't aware of. Yeah. And it's not fair on the other person because they weren't invited into it. Right. But now I can sort of, if they say thank you, that's really nice. If they don't say thank you, well, whoop-de-doo, maybe they're busy. I don't know. Yeah. But one of the things he teaches is be upfront about what you want and fail fast. You're better to get the no early than late. Yeah. Just say, yeah, you're not, look, I really like what you do, but I have to say, I'm not a fister, but I know somebody who is. Can I introduce you to this person here? Because they love it. And can I say their OnlyFans videos are fucking spectacular. You two might get along. Be the connector. And I think there's so much power in being the guy that brings people together. That is, you do this. You're a very good connector.
Thank you.
This bathtub is like, I feel like I've bathed with many of the experts that you have had here. So that's really, I think that's an important thing because you're bringing all of these people together in a way that is unusual and a little bit opening, I suppose. It's you know, you can't be overtly dishonest in a bathtub. Right. With somebody's hands on your knees and all that sort of stuff. So, yeah.
Yeah, thank you. And I could not have done this series till I was in my 50s. Yeah. I could not have done something like this until I had, because I was also working in HIV and mental health and thinking, I have to be someone over here and then I have to be myself over there. Yeah. And it wasn't until the prep stuff started that those two things started becoming more under the same umbrella. Yeah. That I was like, I can show up to be fully who I am. And then in my 50s, it's like, I can also be naked and talk to some of the people, the most amazing people in the world, and have these discussions. And it's not going to be this thing where it's going to be I'm not going to lose my license or it's not going to be leveraged against me in the court of the American morality Puritans to say, well, that person can't, we're going to take everything from him. That was always my fear in the mental health world, which is still pretty conservative in the US. So to me, being in the 50s and learning all these things about sexual health, having all these new innovations come out that we never had around PrEP and U equals U and doxycycline and now the injectables, understanding the different scenarios in which we can make them more effective in our connection with each other, and just the role of cleaning out and dopamine and oxytocin. This is where, to me, the joy comes in.
And I think the model of the gay bar is essential. It creates community, but it's not the end. And sometimes we get a little bit stuck in the 70s that there's this dark little place that we can only meet between 7 p.m. and 2 a.m. or whatever. Start creating spaces. And this is what I love about queer culture, is that it's bringing in, like, there is a queer knit night. There might be a fucking queer book club. There might be a bowling group. In Melbourne, there's a volleyball club. There's a wrestling club. There's, I don't know, like lacrosse, whatever.
Yeah. Here in New York, there's pretty much anything. And if there's not, you can create it.
Exactly. There's going to be at least one other person that wants to play tiddlywinks with you, or, oh my God, like the board gaming amongst the bear community. They love a board game, and you can learn so much about a person by playing board games with them. Are they going to go into the death? Are they going to fight for everything? Or are they there for the fun of it? board games. Get some board games and play them with
Yes.
people. You learn a lot. And if you're in a BDSM space, watching people play board games, you learn what sort of a dom top they are.
Okay, interesting. Okay, George, you're so amazing. If people want to follow your work, continue to see
Please.
your amazing videos,
Yeah,
where's the best place for them to do this?
I would recommend, I have a website called thehealthybear.com.
So that'll be right below, healthybear.com.
Healthybear.com, and I've really got to work harder on that, I must admit. I'm putting together an email list where I'm going to be just giving health tips, and it's not exclusively gay health tips. It's the standard stuff like, here's what to look for in a melanoma. You should be worried about getting your skin checked and all of that sort of important stuff that sometimes doesn't get covered in a prep appointment.
Yeah.
I'm on Twitter. Maybe.
Do you do Blue Sky?
I do Blue Sky. I think I'm Dr. George FS on Blue Sky.
Okay, so we'll do a link to that.
Dr. George FS. And Instagram, if you like photography of cities, every day I do a morning, name whatever city I'm in. So you can work out where I am just by my morning Melbourne shot or something like that.
Wow.
Because I sort of thought I want to bring something artistic into the world every day. And so it's just
It's beautiful.
snapshot.
Wow.
Dr.
Okay.
George FS on Twitter.
So
Thank you.
check out his links down below to follow what George is up to. And as more and more innovations come out in sexual health, you talk about them and you help people learn about them.
Absolutely.
And you also, there's so many other things we didn't even talk. If people want to learn more about foreskin maintenance and butt plug safety, go to his website because it's all on there too. There's so many other tips and tools for joy and pleasure. So next time you're in the US, you just have to come back to Brooklyn.
Yes.
But then we also have to get you to a Waffle House somehow.
Yes,
because you're
please.
missing out, my friend, let me tell you.
Look, if I can have sweet food and a fight, I'm down. Like, I want to go to the roughest Waffle House in town.
Okay, well, we'll go to the south and
okay.
Yeah. If you like this interview, subscribe down below. There's almost 200 of these videos of people that are changing the world, making our community a happier, healthier place. If you like this video, you found it helpful, share it with someone. If you hated the video, share it with someone you don't like, and then everything will be fun. Thank you so much, George. It's such a pleasure to see you.
I'm so happy to have met you.
Yeah, finally. Thanks, everybody.
Bye.